St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, anakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Is that a thing?
Since the year 22nd March in the year 1993 up to date, today being 22nd March 2022, well, this date was set aside for celebrating World Water Day, and today we celebrate it. And there is a little bit connection about the water and our topic of today being hemorrhoids. Welcome to our topic, and the reason why this data was, set aside, it's because of creating awareness of the significance of fresh water and sustainable management. Well, it's very important for everyone, and as you can see, we have water here, and we'll be taking it and make sure, because the temperatures are very high here in Kenya, you prevent being hydrated, drink a lot of water. Welcome to the discussion. My name is Maureen Kimani, and as usual, this program is brought to you by Capuchin TV in conjunction with St. Mary's Mission Hospital, and in the studio we have a guest from St. Mary's Mission Hospital. He will be introducing himself to our viewer and telling us what he does in St. Mary's. Welcome, Daktari. How are you doing?
I'm doing good today.
With a happy World Water Day.
Happy World Water Day to you too. Maybe I can even take a sip.
Yeah, sure, you can. Cheers to many more. Yeah, how are you doing?
I'm doing good. I'd say it's a fairly bright morning today. Yeah, Kumejaa Nairobi. There's a lot of people on the streets, but I'd say I'm good. I'm doing good. I'm doing great.
Okay, good to have you here. Maybe you can introduce yourself to the viewer, tell them your name and what you do in St. Mary's Mission Hospital.
Okay, so my full names are Dr. Kuria Karime. The other one is Harrison. I rarely use it that much. So at St. Mary's, I'm a general practitioner. I mainly work in the surgical department, outpatient department. So it's an interplay between both, but mostly based in the surgical department. Yeah.
Welcome.
Yeah.
It's good to have you here.
Yeah, I'm happy to be here.
Oh, okay. Yeah. Thank you. Our topic today, we shall be discussing about hemorrhoids. I'm sure maybe our viewer have ever heard about this name. Yeah. It's an ambiguous one. Yeah. And maybe you can tell us what is it and how common is it in Kenya?
Okay. So as you've rightly put it, I think most people have heard of the word being thrown here and there, maybe by a doctor, maybe amongst themselves. So it's something that is known, but as you put it rightly, it's quite ambiguous. And I would actually say, even in our field itself, the use of the word itself is already, it's a misnomer, the word itself, because when you say the word hemorrhoid, it alludes to a particular a particular condition or surgical medical condition. But all of us usually have a particular group of vessels, which are usually called hemorrhoidal vessels. So it's something that all of us possess. But once this particular group of vessels that are usually located within and around the anus get a problem or get diseased, they become now hemorrhoids. Now the condition that we are going to talk about today is now hemorrhoid disease. Hemorrhoid veins now getting diseased. Yeah.
Does it have a short form?
Short form.
We can use HD or
or hemos. I'm not so sure, but okay. No short form in medicine.
All right. And is it true that everyone has a hemorrhoid?
So I wouldn't say that. Okay, if we're using the word hemorrhoid to mean the diseased version of the vessels, not everyone has them. Everyone has hemorrhoidal vessels, which are a group of veins that connect from arteries, and then they're draining. They usually drain blood from the region within and around the anus or anal canal. So this is the entry point all the way to where it joins the rectum, where the rectum is where the poop sits before it actually exits. So this particular region has this group of vessels, and they usually called as hemorrhoidal vessels. So everyone has them. They serve a purpose. There's actually a very intriguing structure within and around this particular junction, usually called piles or anal cushions. And it's a very sensitive area and serves a very critical function. So the hemorrhoid vessels usually are within these structures, and these structures have more of a sensory role. They help us to tell the difference between poop and air. So, as an adult, it would be very socially awkward if you're not able to tell that this is poop and this is actually fat. So you need to tell the part. They're usually quite sensitive to do that. So, and the vessels exist in everyone. Just that in some people, due to the various factors that we're going to be talking about, these particular vessels become diseased. And now they start bringing problems, and now we call them hemorrhoids.
Okay, so the correct word to say is that everyone has hemorrhoid vessels.
Yes, everyone has hemorrhoidal vessels, but not everyone has diseased hemorrhoids.
Okay, and who are more likely to have these hemorrhoids?
These hemorrhoids. I would say there's no anyone can get them, because you see the factors that would lead to someone getting diseased hemorrhoids are quite, they're more, a lot of them are usually lifestyle, so you notice it cuts across everyone, all races, all ethnicities. I would say there's a tendency to have more hemorrhoids in people who are maybe overweight. I feel like those are some of the factors that contribute. Maybe pregnancy. I think during pregnancy, if you were to talk to most women, at one point or the other during a pregnancy, they got a hemorrhoid or two, and they disappeared. So I'd say there's an entire long list of some of the risk factors that we'll probably go through. But I would say anyone can get hemorrhoids. I don't see anyone who can say I cannot get hemorrhoids. Anyone can get hemorrhoids. Yeah, you just need to do the wrong things. Yeah.
So we need to be very careful, because it can get any gender.
Yeah, any gender, any race, anyone.
Okay, and are there any types of these hemorrhoids?
Any like types or types? Okay, so I would say how we grade them, we usually rank them as either internal hemorrhoids or external hemorrhoids. So by definition, what this means, internal hemorrhoids, is because there's two groups of vessels that are usually termed as hemorrhoidal vessels. So the external hemorrhoidal vessels are usually just within and around the anal opening itself. So these are veins within and around, so underneath the skin. So these vessels are underneath the skin. Then the internal ones, the internal hemorrhoidal vessels, are usually at the junction between now the rectum and the anal canal itself. So when the disease is affecting those vessels that are inside, it's called internal hemorrhoids. When it affects the veins that are usually outside, now just underneath the skin at the anal opening, it's called external hemorrhoids. So we usually group them as these two groups, and then within and around them, we give them grades now. So grades depending on how bad they actually are. So this we can give them from grade 1 up to grade 4. Yeah. By others it's internal and external.
All right. Yeah. And before we talk about the causes of these hemorrhoids, some people confuse between anal fissures and hemorrhoids. Maybe you can differentiate between the two.
So actually, one thing I forgot to tell you about the prevalence. You asked me about prevalence. Maybe I can take you back a little.
Okay, it's all right.
So in the real world or in the open, I think it's one of those diseases that people are quite embarrassed about. So most people are not willing to openly share with family or share with people around them.
Or even coming for
even coming for medical checkup. So sometimes when you ask me how prevalent it is, studies show or data shows in certain populations, I'd say mostly in the West, because they've done studies nicely, you'd find that in some places there's up to 3 to 4% in the adult population. When you go to other populations, you might find as high as 30% of the population is actually having symptomatic hemorrhoids. But now the problem, because of this kind of embarrassment and people are not willing to share, they don't open up. So we tend to not have real figures, because people are just walking around, they're suffering with hemorrhoids. So they're in pain, they're in constant discomfort, but they're embarrassed to share. So they don't get to hospital, so we don't even know they have them. So we can't even put them in the books that this number of people actually have hemorrhoids. So you see, yeah, that was just me taking you back. But now back to your question on the difference between hemorrhoids and now fissures. These are actually two distinct illnesses. More often, they happen together at the same time. Like somebody coming to you with a hemorrhoid will more often also have a fissure, because the risk factors for getting them are usually somewhat related. Yeah. So a hemorrhoid is this particular vessel that I talked about. Either it gets due to pressure, it gets a clot inside it. Once it gets a clot inside it, the vessel blocks and it starts to swell. And when it swells, it now bulks up the skin. For example, if it's an external hemorrhoid, somebody will say there's a swelling. I have like niko na uvimbe, niko na nundu pahali hapo kwa njia. So they'd say the skin is swollen. But the real thing is that inside the skin or inside the swelling, the vessel is clogged by a clot. Same thing to internal hemorrhoids. But for a fissure, this would be like a linear cut. Like it's like a cut, where due to factors such as, for example, passing really hard stool, so due to that pressure, the hard stool might actually go through and tear. It actually tears the anal opening. So a fissure would be a cut. Either most of them are usually posterior. You could get an anterior one, but it's usually a cut. So versus a hemorrhoid, which is now a swelling, because the vessel inside is clogged with a clot. Yeah, that would be it.
Okay.
Yeah.
And Dr. let me take you back. You mentioned about some people not coming forward, but yet they have the pain. Does it mean that they don't have information about these hemorrhoids? Because if they knew, or maybe they just are afraid of coming forward to say, you know what, and they are afraid because, you know, it's somewhere they don't feel like it's very sensitive.
No, nobody wants to share that.
What do you have to say?
I would say, yes, the information bit. I feel like there's a lot of misinformation out there about how hemorrhoids occur, what hemorrhoids are. I would actually say, even in the medical field itself, possibly, even amongst doctors, being able to diagnose hemorrhoids and say this is a hemorrhoid or this is not a hemorrhoid is a very difficult job. And I would say, a lot of times, whenever somebody is having a disease of the anal region, there's a tendency for the diagnosis to end up being hemorrhoids. Yet, there's so many other things that can happen there. So you notice is that it's just that the manifestations are usually not as clear. Somebody might be saying, as we will get back to how the symptoms usually appear, some of them are quite non-specific. It's just a kind of discomfort. The very specific ones where you know something's wrong is if somebody is feeling pain or somebody is having bleeding. Then that would allow them to seek medical help. But because it's not a disease that manifests itself in a very distinctive way, especially if they're small ones. So I'd say most people would just ignore and just assume their body is just abnormal in that way, and just not share. Yeah, so I'd say a lot of misinformation and also a lot of very non-specific ways in which it presents itself. Yeah, so I think that would be a major reason why people do not go to hospital. And also that other factor, where it's actually located.
But there actually, there's one friend of mine who told me, like, when she was going for the loo, like, she sees the blood on the stool. So that means she is having the hemorrhoid. Okay.
So you wouldn't say absolutely. So you see, if somebody goes to the loo and sees blood coming out, it could be a large list of things. Amongst them, and possibly among the commoner ones, is hemorrhoids. But it could be so many other things. So you see, it's something that is, if somebody is having bleeding when they go to the bathroom, once it's able to be characterized in what way? Like, is it bleeding a lot? Is it just coming out all the time? Is it coming out with the poop? Is it coming out when it's mixed in? Or is it something that they see on the toilet paper when they're wiping? So you see, so these variations will actually give you a clear picture on whether they're hemorrhoids or not. More often than not, hemorrhoid bleeding is usually painless. Most often it's painless, unless there is a clot or unless there's an ulcer. One hemorrhoid has come out, it may quite irritated a bit, then it gets an ulceration. Most of the time that bleeding is painless. It's usually not mixed in with the stool. Either it will be lying on the stool or they'll see it on the toilet paper. So it's very distinctive kind of bleeding. And it's usually very bright red. So it's not clotted blood, it's not digested blood, it will be oxygenated blood. It's quite bright and quite red. So that's usually the typical characteristics of hemorrhoid bleeding.
So the best way to know which one is it, it's volunteering and going to the health center.
Volunteering and having a doctor see you. You know, it's quite uncomfortable. You know, even as a doctor in practice, I've had to devise ways to make people feel comfortable for them to, because you know they're really getting exposed and they're in pain, but then it's an area that they've been hiding. Before they actually get to the hospital, be sure they've been suffering for weeks to months before they actually show up. So you see, by the time they do get to hospital, they realize this is the only one way that you can be told definitively these are hemorrhoids. Because you know, they are visible, it's not something that is hidden inside the body. We might have, for example, for the internal hemorrhoids, you might have to do further investigations to see them, because some of them, if they are not appearing outside, we might actually have to go take the patient maybe to theater, do an examination under anesthesia, where we actually make sure they're not feeling any pain, because we want to expose more and get to see them, or even end up doing a colonoscopy, which is where we drive a camera down through the anal canal, and now we take pictures. We take pictures of the intestines, the rectum, and everything. So once this camera goes inside, if there's a hemorrhoid that is hidden, it will be spotted by the camera.
Okay.
And if there's something that is causing it to appear, it will be spotted by the camera as well.
All right.
Yeah.
Wow, that's very interesting.
Yeah. So definitely come to the if you feel anything weird, just come. You see, like, this is abnormal. This should not be happening. Why am I feeling pain? What are these swellings? Why is this bleeding? Come to hospital. Yeah.
Okay. You mentioned about some of the causes of hemorrhoids. You talked about pregnancy, the mothers. Maybe you can mention more causes of the hemorrhoids.
Okay. So maybe a short explanation. I can try to make it as make it as less technical as possible. Why hemorrhoids occur? So you notice how our bodies are built. There's a particular way in which things move out from. If it's poop in the rectum and it's moving out, there's a particular way they move from the rectum to the outside. There's a kind of an angle that was designed that way, where there's usually direct pressure from stool that is trying to come out. So where these vessels are is at this particular junction and below. So now persistent pressure on these particular vessels, for example with hard stools, it might come and press on this particular region, and then there's no blood flow back. The issue is usually blood is coming in, but it's unable to go out. So since the blood is still coming into this vessel and it's unable to go back, because for whatever reason there's some pressure obstructing, the clot starts to form, or the vessel starts to distend, and now the hemorrhoids start to form. Yeah. So amongst the major reasons as to why hemorrhoids would occur, so hard stools clearly are high on the list. I would say it's one of those things that are complete consensus on what causes hemorrhoids is not really clear. Yeah, it's things that are usually up for debate, but at least as of now, on consensus, we agree that persistently hard stools are a risk factor. I would say there's sitting down a lot, like a posture that usually just entails a sedentary kind of lifestyle, like constantly sitting down. Like our bodies were designed to move around, and usually moving around helps a lot with blood flow. Making blood flow go back. Even from your legs, blood only goes back to your heart if you're walking around. So the same thing to this particular region is also that kind of sedentary lifestyle. It's associated with obesity. It's associated during pregnancy, especially in pregnancy. There is a lot of debate whether it's hormonal changes that make these particular regions prone to hemorrhoids, or it's the pressure from the baby. The baby is lying on the mom and is lying on vessels inside. So now this backup and build up in pressure might actually cause them to get hemorrhoids. Then again, they also get constipation, just abnormal bowel habits during pregnancy that might predispose to people getting hemorrhoids. So I think there's a lot of debate within and around whether I'd say anal intercourse is a factor. I think there's still unclear, as I've said. That is bedroom stuff, and you notice not that many people are going to be forthcoming. The people will be there at a practitioner's office, and when they're sharing the information, some of the information that they deem personal, they might not share. So you see now the clarity on whether anal intercourse is also a risk factor is here nor there. So those are among the things. So within and around that, I would say at least that's kind of a summarized list. But on top of the list, I will insist, is this issue of chronic constipation. Just having, so you see, as you notice, most of the things, apart from pregnancy, most of the things seem to be lifestyle related, you notice. And I think there's also a thing where data shows that it's more commoner among people of higher socioeconomic status. So this, it's a hard one to quantify.
Definitely, because they are, related to the sedentary lifestyle.
Because now you can afford to sit around more. And maybe the quality of food that people are eating as well is a significant factor. I think we'll get to that, because I really do want to talk about food. I'm sure we'll get to that.
Yeah, sure. And I'll catch you. Maybe we can take a very short break, and then when we come back later, you can maybe begin with that.
Yes, I think I can start there.
Okay, thank you so much, Dr. Kuria, for that information of the first part of the introduction of hemorrhoids. And I'm sure that you are learning a lot about this topic. And the most important thing is that make sure you drink a lot of water, because drinking a lot of water prevents constipation.
Yeah.
And
actually, when we're talking about diet, water is going to be playing key.
All right.
Lots and lots of water.
And that's why we are. It's a very good coincidence, because you're talking about
It's
the World Water
Day.
Day. Yeah. So we're taking a very short break. We will be right back. Stay tuned.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have a dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa hivi mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 07 17 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
A similar answer.
Yeah.
I can give a similar answer.
Hello dear viewer, welcome back to our program of the Health Talk right here on Capuchin TV. My name is Maureen Kimani, and in the studio we have Dr. Kuria Karima from St. Mary's Mission Hospital. And before we had gone for the break, we were talking about some of the causes of these hemorrhoid. Maybe I can give Dr. Maybe you can continue from there. Welcome back.
Okay, thank you very much.
Yeah.
Okay. So I think maybe what I wanted to talk about a little is about the symptoms. Maybe just to I alluded to them before. Maybe now I can just give a clear guide to what they would manifest themselves as. So now, as I said before, the symptoms tend to be quite non-specific. So you see, somebody might be saying they're feeling itchiness. There's some discomfort, as can come on a sweat, then there's some itchiness. This kind of itchiness usually comes from the fact that there might be something swollen there and it's just sitting there. And you know, this area is quite sensitive. And so now what your brain interprets this added volume there, it translates it as itchiness. So it might be somebody saying some itchiness, some irritation. In the worst case scenario, if a hemorrhoid is stuck outside for long enough, it might get an ulceration. And you know, you can realize this is a very busy place. It never stops working. So it might get irritated, stool might irritate the skin there. So and then in the process, it gets an ulcer. And this is when people start getting pain. So pain symptoms occur in either when the hemorrhoid ulcerates or when the hemorrhoid thromboses. This is when it forms a clot. A clot forms inside, and now it causes blockage of the vessels entirely, and it starts to distend more and distend more and distend more, especially for external hemorrhoids because they are on the skin. And the skin is usually quite sensitive. So those ones that are external will be painful when they start swelling up. Yeah. So maybe that's a bit about the symptoms. So that symptom of itchiness and irritation is the one that people ignore. The pain and the bleeding and the ulceration, they won't ignore, they'll come to hospital. But that irritation, they might think, itaisha, but they should maybe get that checked out.
Definitely, because everyone fears blood.
Yeah. Once you see blood, I know most people cringe. Yeah.
Yeah, there's a question here. I hear a doctor.
Okay.
I have not gone for a long haul for 3 days. What could be the problem?
Okay. So now, when we talk about the frequency of passing stool or going to the bathroom for a long haul, so it varies from person to person. I think everybody's intestines move at a different rate, and then everybody's diet is not the same. So, and different types of food move at different rates within the body. Yeah. So now, a range that I would give as a doctor would be between 3 times in a day. That would be okay. As long as it's not in too much volume, it's not too loose. 3 times in a day is normal. So somebody going, and you're going 3 times in a day, nobody should shame you. That's okay. Yeah. To up to 3 times in a week for some people. So you see, there's quite the range. Some might be going once in a day. Some might be going once in 2 days. You see. So now 3 days already becomes suspicious, especially if it's associated with not passing gas. If you're not passing stool for 3 days, maybe it's how you're eating, the volume of what you're eating. But if you're also not passing gas, then that combination maybe needs to be reviewed by a doctor, because now this is in the setting of more menacing symptoms such as obstruction, in the case where nothing is coming out. But 3 days, but the person is still being able to pass air or pass flatus, might be okay, depending on what they're eating. Yeah. So if it's been in the last 3 days, maybe they be watchful, they take more water, they can go and take maybe some of the medication, some laxatives. Some of them are off the counter, most of them are usually prescribed by doctors. That would help to relieve something that is not, I would say, not menacing as an obstruction. But in the case that there is no stool, and then there's also no air, and then it is associated with symptoms of abdominal fullness, like anasikia kama tumbo inafura, anasikia anatapika, unaona vitu kama hiyo. Once it's associated with such symptoms, then that needs to be taken care of immediately, anafaa ende hospitali. But if it's just something they need to notice now, you know, a lot of people don't really engage with their gut that well. You need to communicate with your gut all the time. You need to know what is going in and what is coming out. Yeah, so things like that. Some people, maybe they're not keen on what they're eating, and also not keen on what's coming out. But if you're able to monitor yourself, you know what's going in and what's going out, you can actually time yourself. Yeah. And some people even program themselves that they know their body is already automatically, and adui masaa ikifika ni hiyo masaa.
True. Especially in the morning.
For some people unasikia the specific times. So you see, it's a very programmed thing. But now it depends. If your lifestyle is consistent and you're eating consistently good food all the time, now you notice unakuwa na a consistent pattern, so you can always tell inakuja. Yeah, things like that. So for 3 days, unless it's associated with all these other symptoms, or maybe it's something that kwake, even in the past, this has been a trend. Maybe it's something that is normal for them. So up to three times in a week is also okay. Yeah.
Okay, thank you so much, Doctor, for that answer. Okay. Let's talk about thrombosis hemorrhoids.
Okay.
What are those?
So so thrombosed hemorrhoids, as I alluded to before. So now this is when you see now if there's so there are specific triggers that usually trigger. Somebody might be having hemorrhoids that are not thrombosed yet. So they're just distended, they're just lunky there, they're uncomfortable, they're itchy, they're irritating, but they're not painful. So in the off chance that they engage in something that is a trigger, sometimes strenuous exercise or strenuous activity is a trigger, including straining in the toilet. That's straining to push a hard stool. If it persists for quite some time and blood sits in the vessel for long enough, it starts to clot. Yeah, so it might be triggered by strenuous exercise or straining in the loo, and then this blood sits there for longer than it should, and then it clots. So once it clots, that's when we say that hemorrhoid is now thrombosed. It's no longer just a hemorrhoid; it's a thrombosed hemorrhoid, and these ones are quite painful. And a lot of times, this is when patients usually come to hospital. And in this setting, a thrombosed hemorrhoid is quite big, it's quite tender, and sometimes just to relieve the pain, these ones might actually have to be removed in the acute setting. A lot of times, the symptoms might resolve within a week to 14 days. So maybe a week to 2 weeks, the symptoms might actually resolve on their own. But you notice, this is after a period of a lot of suffering because the pain persists. Yeah. So a lot of times, whenever it happens, the usual immediate response is usually to take it out, and you take out the whole hemorrhoid, just to make sure that you relieve the symptoms. But if the patient was to sit at home with it, it would actually relieve within 10 to 14 days in Aisha yenyewe. And especially for external hemorrhoids, what would be left behind is like a weird-looking skin tag, like an extra flap of skin, which is something also patients complain a lot. So when a patient comes in and they have that extra flap of skin, I'll just know at some point in their past they had a thrombosed hemorrhoid that resolved on its own.
Okay.
Yeah, something like that.
And how is a hemorrhoid diagnosed?
A hemorrhoid, okay. So for diagnosis of a hemorrhoid, I think clinical stories in a patient, which the patient will come and tell me, is key, is important. It's within and around the part we had talked about before. So what are they feeling? Is it itchy? Is it irritation? Is it pain? What are they feeling there? Is there swelling? Is there a lump? Is there something that is growing out? Is there something that is there sometimes and disappears? Is there something that comes out and then they have to push it back in? Like things like that. So those are things that the patient will actually tell me. So if I can get this information from them, and is there bleeding now? And what type of bleeding is it? Characterizing it. Is it on the toilet paper? Is it on the stool? Is it mixed in? Is it just before? Is it any time? Things like that. So at least once we have a story from the patient like this, then I'll proceed to examine myself. So on examination, I think of key, a DRE, which is a digital rectal exam, where the doctor will have to see it, the anal opening, observe it, make clear notes on what they can see. And in the case that somebody is not in pain, a doctor might have to examine with a finger, might actually have to stick a finger and explore inside to see whether there's anything that is hidden. Because as I said, external hemorrhoids show themselves. Like the moment the patient bends down, you actually see it. There it is. But internal hemorrhoids tend to be hidden, especially the grades that I was alluding to, where we talk about grade 1, grade 2, grade 3, and grade 4 for internal hemorrhoids. So grade 1, grade 2, grade 3, and grade 4 for internal hemorrhoids, what it means, a grade 1 hemorrhoid is one that the patient might never see because it's completely hidden. This is the ones that usually come and they complain about itchiness, that discomfort, that irritation. It may be some bleeding, but it never shows itself. This is specifically for internal hemorrhoids. A grade 2 hemorrhoid would be one that when the patient is bearing down or is going to the toilet or trying to pass stool, as the stool comes out, this hemorrhoid pops out. But then once they're done, it goes back in. A patient would describe something like this. Then a grade 3 hemorrhoid would be one that when the patient goes to the loo, it pops out, but doesn't pop back by itself. The patient actually has to push it themselves with a finger. Then grade 4 would be one that once it pops out, doesn't go back in. The patient will come, they're unable to sit because maybe it's gotten ulcerated and there's some pain and they're just uncomfortable. So that is one that is completely outside. So these are usually the grades. So by the time we're making diagnosis, that history, that story that the patient will give me points me towards what it is, what grade it is, especially for those internal ones. The external ones, they're pretty easy because they're right there. Like they just show themselves. Yeah. So diagnosis will be within and around this. To add on to this, especially for the other tinier ones that are not clearly evident, an examination under anesthesia might be needed, where the patient is put to sleep, or at least anagandisho kwenda chini, and then we're able to examine with no pain. Because you notice when the patient comes in with a lot of pain, you might not be able to even stick a finger. So you have to put them to sleep a little to make sure they're not in pain, so that you're able to examine more closely and figure out whether it's a hemorrhoid or not. Beyond that, we could also do a colonoscopy, as I'd alluded to earlier. So where we stick a camera and it just pokes and then takes images. If those hidden hemorrhoids can be spotted, they'll be seen on a colonoscopy. Yeah.
And after doing all of that, how is a hemorrhoid treated?
So now, based on the degree that the patient is going to present with, I'd say majority of them usually come, for example, for the internal ones, they usually come either as grade 1 or grade 2. By the time they're getting to grade 3, grade 4, which is less commoner, most people are usually either grade 1 or grade 2. And especially for internal hemorrhoids, I would say surgical management or surgical options, that is cutting them out, is usually a last resort. Yeah, and at least I'll put down a list of when we actually do surgery, which is a last resort. Majority of the time, the management for hemorrhoids is usually these other things that we've been talking about. Is this kind of lifestyle change, how you're eating, how much you're exercising. Yeah, if you have some extra weight and that predisposes you to get hemorrhoids, you need to lose the weight. If your diet is not rich in food that I think the primary school name that we used to use was roughage. Remember? And this was it's something we were taught. You notice it's something we were told as children, that roughage is important. You need to eat your fiber. But then as adults, when we're the ones making the decisions on what we're actually eating, we tend to make the wrong choices. So you see, so it's about this lifestyle change and thinking about food very differently. Yeah, it doesn't just have to be you're focused on food that tastes good. But even if you're focused on like KFC, unakula KFC, unakula chicken, you see those kinds of food. Like for example, that type of food, there's a lot of added extra things that they don't mention when they are serving you this food. But you notice ukienda kula kama kuku ya chicken in, yes, it's a chicken, but then around it, they've added extra flour. And it's this carbohydrate, this flour that I'm saying, goes in into your body and becomes hard, and then you keep on getting constipation because your food is not rich in fiber. Food that are rich in fiber, these are veggies, green leafy vegetables. Salads are good. Fruits, mangoes, pawpaws, avocados, these are things that are rich in fiber, and you need to incorporate them in your diet. I'm not saying don't eat starch. Yes, eat starch because you need it to get energy, but make sure that it's in a combined balance. And a quantification that I usually try to tell patients is, if you're eating starch, unaiachia at around, let's say a fist size, then everything else on your plate should be things that are rich in fiber. Yeah.
And you've talked about the surgery.
Yeah.
When one is performed the surgery, does it mean these hemorrhoids can reoccur again?
Yeah. So now, as I said, we prefer sticking to this non-invasive modalities of treatment. We always hope we find patients in this particular group of hemorrhoids that don't need to be operated on. But in the off chance that somebody comes to the hospital and they're having grades of hemorrhoids that actually might need surgery, as I mentioned, thrombosed hemorrhoids. No one can sit with pain for 14 days. These ones usually need to be removed. So these types of hemorrhoids that are prolapsed, that is grade 3 and grade 4. Yeah, this when I talk about the meaning of the word prolapsed, these are hemorrhoids that are coming out but then not going back in. So they're just sticking outside to send me. So those ones need to be removed because clearly they are uncomfortable, they might get ulcerated, they might bleed. So these are the kinds of patients that you would perform a surgery on. But when you perform a surgery and take out this particular hemorrhoid, if the same patient goes back home and then they go back to living the same life that they were living before, they will come back. That's usually so the risk of them coming back is there. But if the patient can institute some of these lifestyle changes that I keep talking about, then maybe they don't recur. But chances of them recurring are quite high. Because even when someone gets a hemorrhoid, for example, today, it's not treated surgically, but then it resolves on its own. There's a 40 to 50% chance that within the next year or two, they'll have another attack. Yeah, so that's usually the thing. So they have a tendency to occur and reoccur. Yeah, and even when we're performing the surgery, we try to take out the particular diseased hemorrhoid. We try to completely cut it out or remove it. But the way veins usually behave, they have other channels. Like it's not just that one. You'll notice that ikona my sisters and nani surrounding it. So you'll take this one, then the patient continues with the same lifestyle that they had before. So the other veins that were we call them collaterals, but they usually just serve to give different routes for the blood to leave the area. So these other vessels that are there, then they become hemorrhoids. So you notice. So even if you take out one that was already deceased, if the same risk factors persist, then another one will form. Yeah.
Wow.
So the surgery, I wouldn't say the surgery is complete cure. It's that other thing, that other lifestyle change that would possibly be the bigger factor. Yeah.
Okay, I understand there are some of the home treatment that are used to prevent hemorrhoids. There's even a cream.
Okay.
Maybe you can talk about it, and maybe if there is a person who is watching us and maybe they were given the cream, how are they supposed to apply that?
Okay. So there are creams, and I know these ones are prescribed quite often. I'm sure at one point or the other, somebody having these symptoms was given a cream or some suppositories or tablets that they have to insert. And things like that, or just powders that they will apply in the anal region. Some of these creams are usually either steroid-based, either they contain a steroid, some of them might contain a local anesthetic that just alleviates pain. And within and around this particular medication, it helps to calm down those acute symptoms. Yeah, I would say they're usually not necessary or needed in all circumstances of hemorrhoids. If, for example, a patient is having a hemorrhoid that is not painful, it's not bleeding, it's not manifesting with ulceration or any kind of injury, maybe these ones are not necessary. But once the patient gets to a point where they're having these particular symptoms, then maybe these particular creams and suppositories can give relief. Because you see, with a steroid, it lowers the immune response in the area. And the immune response is usually what causes the pain. Because now you see, there's an injury, your body thinks Nikubaya, then it just sends the police there. So once it sends the police there, which are the white blood cells and blood and everything, there's a very big reaction. This is what brings about the pain. So trying to lower this kind of immune response usually tends to alleviate the pain. Yeah. So you see, it's a temporary fix. It's not a complete fix. So you'll find patients out there using these creams and these suppositories again and again and again. And you know, some of them have their own side effects. Yeah. Especially with steroids being used. Topical steroids might be safe because sometimes they don't really go into your blood. But you notice constantly using it on that particular area of the skin actually makes the skin weaker. So now continuously using it might actually predispose the anal skin to certain other things. Maybe it easily gets injured, it easily gets bruised because now it's thinner, and things like that. So it has its complications. So as I say, these creams, these ointments, these suppositories are not a permanent fix. Yeah, they're usually there to alleviate the symptoms whenever the patient is having pain and discomfort in that acute setting.
So in case a person have been using the cream and maybe it's not even helping, so you have to seek the doctor, maybe you go and they can do some,
maybe it's even something else. You notice now, somebody, as I said, the symptoms are quite non-specific. So you see, depending on who you see first, if you see a GP like myself, the information that I may possess might be different from what you might get if you see a consultant. And if you go and self-prescribe at a pharmacy, or you go and get a prescription from another dispensary. So you notice the information that these people possess differs slightly. Yeah. So you might find that by the time you're constantly going back and you're getting this opinion, and like for example, for me, I would say the symptoms are like this, you're feeling pain, whatever I will prescribe, it will be based on my expertise. So you see, now there's all those levels. But my advice would be, if you're seeking treatment, you're seeking care, I would advise don't go to a pharmacy to just ask for something that you think umeambiwa na rafiki yako ameitumia, umeambiwa. No, don't do that. Try and go to a trained professional who can actually give you advice.
And can depression or emotional stress cause hemorrhoids?
Depression or emotional stress? I do not think so in a direct way. Like it won't be in a direct way, because now maybe I can digress a little and try to imagine, in the setting of depression, what kind of lifestyle somebody would be leading. So you notice when somebody is, for example, people who are having anxiety, or people who are having depression, or people who are having whatever other mental illness that tends to rob them of the ability to take care of themselves, to take care of their diet, to take care of their exercise habits and their patterns, such kinds of diseases might predispose you if you now lose this ability to take care of yourself. Because you notice it's a conscious effort to make yourself exercise, to make good food all the time, to make the right choices, and especially when it comes to your gut. So in the off chance that you're having this like a mental illness that is robbing you of this ability to do so, then I would say in the long run you might get them, but it's not a direct causation. So it's more of you not taking care of yourself because you're having this other mental illness symptoms that are making you not take care of yourself. I would imagine it in that way.
Okay, and maybe there's some of the ways maybe someone can do a self-testing, looking at yourself in the mirror. We have a phone. Can you maybe explain to our viewer about those stuff?
Okay, if they can be able to identify hemorrhoids themselves. It would be pretty easy, especially for external hemorrhoids. So you see the more obvious ones, now these are the ones that are popping out. Even just having a mirror and checking yourself might actually be quite useful for them. Yeah. So just having even a camera, even a phone, you see, it's quite easy. You're just squatting in the loo, and then you just take your phone and take a picture and look at it. It's something you can see. I know a lot of people. I've had this discussion, and I'm noticing people are quite uncomfortable to examine themselves and see their bodies, especially when just haujaiona inakaje, haujui kuna kaje hapo hivi, maybe unasikia na kidole and that's it. But then don't be afraid to check yourself out. Just have a look, take a picture, take a mirror, look at it, see. You'll know what there's images online. You can check out images and see what a normal anal opening should look like and what a hemorrhoid should look like. So by the time you're taking a picture, you'll actually see it and see when you need to see a doctor. But I would still advise, if you're managing it, don't just stay home suffering alone. Come and get the help from a medical practitioner. It will go a long way. So if you can get someone who can give you the right advice, it will go a long way. But if you were to self-identify or self-diagnose, do it, see it, notice that it's a hemorrhoid, but don't self-treat. Yeah. Come and have a discussion with a trained professional.
Okay, thank you so much, Doctor, for that. Before we wind up, is there something that you want to add up on this topic of hemorrhoid to our viewer?
Okay. For me, maybe you've noticed already, I'm a very big proponent of, let's say, healthy eating, making right food choices and so on.
Exercising.
And exercising. Actually, exercising is very important. It takes away a lot. If your body is able to move better, you feel more comfortable in your body. So you notice that a lot of these other things that come about are not going to be there. So in this particular case that we're talking specifically about hemorrhoids, on World Water Day, I will start on the list. Drink plenty of water. Like, I know some people out here, at least I've met people out here who maybe don't have a taste for water. It's something I'm starting to notice is a thing. There are people who enjoy the feeling of drinking water and they'll drink water daily. But then there's some people who sort of don't enjoy the act of drinking water. I think it's something that maybe I myself should study a little more and find out more information about why this is so. So in the case of that, I would advise people who feel like they are not able to take adequate amount of fluids, find other ways to take those fluids. Drink juice, drink tea, drink anything that will make you drink water. Flavor your water if you have to, but make sure you get that water into your body. Yeah, so that's number one. Drink plenty of water. It's good for your muscles, good for everything, good for generally everything. Yeah. When it comes to food, I noticed in Nairobi, especially, there's this big problem. There's a thought I've been having where within 10 minutes of where most of us live, can you attest that you can actually get food and get good food within 10 minutes of where you stay? If somebody, if the viewers at home were to think about it, and when I say good food, is good food that a doctor would come and say, this is quite balanced, this has all the nutritional groups that you will need, it has the right amount of fiber to help you not get hemorrhoids. How many places within 10 minutes of where you live can you say you can get this? If most of us were to think about it, because at least I have thought about it, and I've noticed, nikitoka nje nikitafuta tisa nimesema leo sijisikii kupika. And I'd advise most people, cook for yourself if you can. Yeah, because you're able to decide.
What about those people who can work late night?
That is why I'm pointing out, because even me as a doctor, I find myself in situations where I don't have the time to cook. Yeah, so I might get home and I'm like, I'm so tired. Let me go find somewhere where I can eat some food. And I've done this a couple of times. And what I've noticed is that by the time I start walking, within 10 minutes, all I'll get is joints that sell junk food. Yeah, there's galitos out there, zimefunguliwa kama vibanda. Kuna chicken in that you can just call and phone and get the food delivered to you at any time. And I'm not hating on technology. It's a good thing. It's a good thing that those are jobs, those are opportunities for a lot of people. But I notice in that there's a promotion of a lot of unhealthy eating. Yeah, people just order. You're ordering unhealthy burgers on a regular basis, fries. If you're eating fries and chicken, if you're ordering just fries and chicken, that is not a whole meal. You need something else to make sure that those fries and chicken actually leave your body peacefully. Yeah. So you see, and this is usually what people have readily available. So what I would really encourage is people to really take charge of their eating habits and what they're actually putting in their body, and establish a kind of relationship with your gut. Because I feel like your gut, in medicine, we usually call it like a second brain. Your gut is like your second brain. Like it's like as your brain is working here, your intestines are just working sort of autonomously on their own. So now, if you're able to communicate with your gut nicely, and the communication that you get with your gut is that symptoms, if something makes you bloat, makes you uncomfortable, just makes you feel a certain way, you feel more tired, you're eating certain foods, and instead of feeling energized, you're feeling more tired, try and start paying close attention to how your body feels. Because your body will always tell you what is good and what is not good. Yeah. And hemorrhoids is part of your body telling you whatever you're doing is not good. Yeah.
Interesting. That was a very formative session with you, Dr. Kuria, and thank you so much for coming and making sure that you inform our people out there, and even for us. I've learned a lot, to be sincere.
I'm happy.
Yeah. And as we wind up, maybe you can tell our viewer, in case they have those signs or they want to just come to the office and see you, how can they get you, and maybe the office hours, when is it open in St. Mary's Mission Hospital?
So at St. Mary's Mission Hospital, we have a robust surgical department, a very good team, led by very good consultants who are quite knowledgeable in their fields. Yeah. So I think every Monday and every Thursday we usually have a surgical clinic. This particular surgical clinic, we deal with matters within and around, like all sorts of surgical cases that might end up at our doorstep. We'll know what to do with them. If we're able to manage them there, we'll be able to manage them there. If we're able to direct you to a place where you'll get the right service for something that we cannot offer, we will be the right people to actually talk to. So we'll be able to direct you to the right places. So if you're having such symptoms and you're suffering at home, usiumie peke yako, we're here to help. So every Monday, every Thursday, you can book an appointment with our general surgeon, and you can pass by, and we can have a discussion about these particular symptoms that are ailing you and give you the solutions.
Yeah, but you're not praying for people to get sicker, and
I am not praying to get people to get sicker. Yes,
that's why you have insisted for people to make sure they be careful with their diet and exercising a lot, and also drinking a lot of water. As we talked in our introduction, that today is a World Water Day, and as you can see, I have water here. Make sure you take a lot of water, because there's a lot of high temperatures around in Kenya. Don't be hydrated, because that might cost you later on constipation, and just be careful. That's all I can say. Do you have something to part short with?
To part short with? I've been happy to be here. I think I enjoy sort of breaking down this kind of information that is seemingly restricted to the medical field, and we talk a lot of jargon, we talk a lot of technical terms when you meet us, but I think the joy is usually in piecing down and making the information more palatable, and making sure that whoever's listening actually understands. Yeah, because you need to understand your body. Yeah, no one else can understand your body for you. The patient is the one who has all the information. Yeah, so at least I would say I've really enjoyed being able to talk about this particular topic. It's a topic that I'm quite passionate about, because I see a lot of people suffering.
Yeah, we can
and it's something I would want. It's suffering that no one deserves. Yeah. So with the right information,
It was nice having you, Dr. Ri. Thank you. Say hi to our St. Mary's Mission Hospital surgeons and everyone else. Thank you for making time. Thank you for coming and for educating our viewers out there. And in case you were joining us right now, don't be worried, because you can still follow these discussion on our YouTube and Facebook, later on, and you can be able to educate yourself. And later, after you have grasped that information, make sure you share with other people. Thank you so much for following this discussion right here on Capuchin TV with me, Maureen Kimani. Thank you to our camera people, that is Felix Juma, Christopher Odhiambo, all the people, the crew that has been behind the scene. We have Mike Ondegwa, DJ Fredox, that is Frederick Ochieng, right? Frederick Ochieng, and lastly but not least, we have our transmission manager, that is Michael Kibandi. Thank you so much, and may God bless you. Have a good day, and happy World Water Day. See you next time.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have a dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 02